So here at Passaway General Hospital, the unit manager of our intensive care unit has asked me, with the increasing frequency of central line associated bloodstream infections, otherwise known as CLABSI or CLABSIs, to prepare a presentation on the prevention methods. A central line associated bloodstream infection is an infection that occurs when pathogenic or microorganisms enter the bloodstream through an opening in the skin from the catheter insertion site. The CDC outlines some precautionary processes that we can implement that are in practice today, or supposed to be, to prevent these central line associated bloodstream infections. For this presentation, I have reviewed and analyzed 3 evidence-based pieces of literature. The first article is a meta-analysis that examines the impact of implementing various interventions to prevent these types of infections. The different types of studies that were used in this meta-analysis included non-randomized and randomized controlled trials, controlled before-after without control, interrupted time series, and it ended up being 43 studies in 584 ICUs. The dependent, independent, and other variables are listed, as well as the controls and how the results were measured. The results showed that there was a more effective results evidenced when in collaboration with the prevention methods outlined by the CDC. Nurses also went ahead and used checklists to hold themselves accountable. The authors also recommended, when moving forward and continuing research, to go ahead and not use as many time-sensitive studies, because that did not allow for inclusion of 11 studies that they were looking at. The second article was a systematic review that outlined its PICO as: what are the central line associated bloodstream infection related preventative measures implemented among adult patients hospitalized in an ICU? The purpose, again, of this study was to analyze the evidence-based care in preventing these types of infections. The sample size and design is also listed on the slide. This particular systematic review used randomized clinical trials, cohort studies, observational studies, pre and post-test, quasi-experimental, systematic reviews, and in vitro tests or bench studies. I found the results astonishing to find that 26 out of 34 of the included studies in the review showed a decrease in the contraction of these central line associated bloodstream infections. And again, the last article was actually a worldwide survey conducted as an online questionnaire that used the Likert scale. That was translated in 5 different languages and actually asked healthcare professionals their attitudes towards implementing and studying what we can do to further decrease the incidence of these central line associated bloodstream infections. So all in all, in conclusion, I found that using these processes that are mentioned in the 3 of these articles will continue to decrease the central line associated bloodstream infections. However, more research needs to be done to find long-term effects that aren't just short-term in ICUs in acute hospital settings, but long-term prevention of these infections.